Thank you for joining us tonight. We're so excited to have you on. We have a really great program for you and two really great presenters with some great content to share with us. So first, I'd like to introduce Dr. Cordula Ahnhudt-Franke. She's a consultant dermatologist with a PhD from the Department of Dermatology in Charité, Berlin. She specialized in aesthetic dermatology and laser medicine and has been running her My Skin practice in Mallorca since 2002. She's a member of several medical and aesthetic societies, both in Europe and the US, that you can see listed here on the screen, but those include the American Academy of Aesthetic Medicine, the European Society of Cosmetic and Aesthetic Dermatology, the International Society of Dermatology, and the European Society for Lasers and Energy-Based Devices, amongst several others. We also have with us Dr. Didac Barco, who's a dermatologist from Barcelona. He holds a master's degree in aesthetic dermatology from the University of Alcalá de Henares and in lasers and photomedicine from the Polytechnical University of Catalunya. His passion for laser therapy and for the treatment of scars has led him to stages in the UK at Aberdeen's Royal Infirmary Hospital and at the US at Chicago's Northwestern University Hospital and New York's Mount Sinai Hospital. He's a guest lecturer in world-renowned congresses such as 5cc and IMCAS and a teacher at the University of Alcalá de Henares in Madrid and at the University of Cardinal Herrera in Valencia, both for master's degrees for dermatologists. He's the author of national and international scientific publications and book chapters regarding laser therapies for scars, and also directs online courses for dermatologists in Spain and Latin America, coordinating their observership stages at Corium Dermatology in Barcelona. Thank you both for joining us this evening. We're also very excited to have you.
So hello, my dear friends, my colleagues from all over the world. It's always a pleasure for me, to have those webinars, and I'm a really big fan of that. And I'm also a really big fan of this topic, acne, because I think this is a disease that we really have to treat very well, and we really have to develop our new therapy tools and our new therapy plans, and this is something we would like to share with you tonight. So before we go into the acne itself, I think we have to recap a little bit the acne pathophysiology. So we have to remember acne is an inflammatory disease, which is a sebum overproduction of the sebaceous glands, which then leads to a blockage of the sebaceous gland excretory ducts. And additionally to this, we have follicular hyperkeratosis on the surface, which blocks the surface of the skin, and we see a perifollicular inflammation. So all this leads to the pathophysiological process of acne, and additionally to this, of course, we have a bacterial colonization. So it's the cannon fodder for the sebum, so which all the bacteria love. So what our idea always is to address the treatment of acne at the different types of the pathophysiological factors. And depending on how deep the inflammation is, we can have a risk of scarring. So if you go ahead here, you remember all those acne lesions. So depending on the different types of acne, we can see comedones, like closed or open comedones. We call them whiteheads or blackheads. We can see papules or pustules, and we can have deeper lesion they go deeper into the dermis, which are the papular pustules and the cysts, and these lead us to a really high risk of scarring. So if you remember scarring of acne, you will all know that we can differentiate different types of scars. So the first one, which I think is the most difficult and most challenging to treat, is the ice pick scar. So we have a really deep and narrow pitted scar, which goes into the dermis, so very deep. Then we have a rolling scar, which is more like a broad depression with a sloping edge Then we have boxcar scars. Yeah, they are more broad depressions with the sharply defined edges. Then we see atrophic scars, which are rather flat and thin or depressed. And then we have the hypertrophic scars and the keloids, which are more thick, more lumpy, and of course need to be addressed differently. Yeah, so here you see another overview of how deep the scars can go. Ice pick scars, they reach the dermis. The boxcar scars can be slightly more superficial, but also you find them in the upper dermis, and the rolling scars as well reach the upper dermis. So what's always our aim in the treatment of acne is actually to prevent scars. And I think this is what we really have to educate our patients more and more, that they don't even reach this severe stage, so that we start to first diagnose them in really early stage, so that we early detect also the progression of acne, and that we timely initiate a proper therapy, which is not just consisting of a topical treatment that they can buy over the counter or in the parapharmacia. So this is really, really important. So also, I think we have to explain to our patients and their parents and their friends, and I think social media is here a really big helpful tool, that a moderate and severe acne does not disappear by itself. So it's not just a pimple which appears in the age of 10 or 12 and will disappear by itself. The moderate and severe acne is a proper inflammatory disease which has to be treated medically and really professionally. Yeah. Also, attention in case of positive family history. If you talk to a teenager suffering from acne, you should always ask if there was a positive family history, if there was the mother or father affected as well, the risk of a more severe cause of the acne is very likely. So which means for us, we have to start a really sufficient treatment in an early stage without waiting too long. Yeah. Also, topical therapy is not sufficient for moderate severe acne, so we need to combine it, and I think this belongs into a hand of specialists. Yeah, so diagnosis of the acne is important. Which type of acne do we see? And then how do we address it? We often see a delay in therapy due to self-treatment. So most of the time, patients come in and they were recommended by the family, by friends, by whoever, self-treatment with lots of different creams and cleansers and masks. Yeah, so this is, by that we lose really important time. And one key message that you should take home today is use the IPL at really early stages. I will show you cases and I will show you how to use it right and without any risk. And you will see how happy and satisfied the patients will be with this. So IPL, you are probably all familiar with Nordlys SVT. Nordlys is a fantastic device, fantastic IPL device, which works with a narrowband selective wavelength technology. So which means we do have filters that are filtering away the wavelengths, the higher wavelengths that we do not really need to address. So that allows us to achieve a really high absorption in the target chromophore, which is hemoglobin in our case of acne. And the handpiece that we are working with is the PR 530. So with this one, we see two peaks at 542 and 577 nanometers, and it's a really fantastic device and fantastic handpiece to address acne in all kinds of inflammatory stages. I will show you later. So what is the PR doing? We reduce the number of bacteria. So it's really working antibacterial. It's reducing the pro-inflammatory triggers. Yeah, we reduce the sebum production as well. Yeah, and it has been histologically proven that the inflammatory cells, which are aggravating the inflammatory process in the gland, is reduced. And so this is mainly the approach that we can see with the PR: improvement of inflammation, reduction of bacteria, and reduction of sebum production. So the treatment protocol is actually pretty easy. So you can use, and at the Nordlys, we have a very great menu. So you just choose the acne mode, which guides us to 7 millijoule double, 2.5 millisecond double pulse. So this is the standard setting that the system is recommending you. And I work with this one a lot. I sometimes change up to 8 millijoule, but not much higher. And I always start with this first single shot with the templates, with those white papers, you know, which have these little holes, yeah, and I watch the change of color. So you just need to wait for a slight color change into a light purple, into a blush grayish endpoint. Yeah, so this is your endpoint, and you can shoot 1 to 3, 4 times on one spot, and you will really notice, and you can palpate how the papule is actually melting and how it's going away and how it's softening. Yeah, so it's really easy to do. Always start, if you're not sure, if the patient is new, always start on the actual papules before you work in the bigger session or in the bigger area around it. Yep, always start there, and you will see how easy and nicely it works. I show you here a patient. She suffers from acne excoriae. We all have those patients in the clinic. They are really challenging. She's in her 30s. It's very often a very similar type of patient. It's usually young female. They're very aware of the body. They really watch the diet and use really good products, but they have a psychological tension, so to speak. Yeah. So, and they constantly manipulate on their acne in the face. Yeah. And it's the same. It's the case in her as well. So she's super nervous, super concerned about herself, about her, the way what people think about her. So quite a psychological, disorder, I would say, even. So what happens is when we treat her, you can see on the left side, she has really inflamed papules. She told us that she's picking on them, she manipulates on them with needles, and she doesn't stop before they open or before they bleed even. And this is how she aggravates the inflammation all the time. Yeah. So, and this is actually the problem. On the right side, you can see the result after a week. So they really do reduce nicely, but at the same time, she's already working on new ones, and she's creating new papules. And this is the problem of the course of acne excoriae, and some of them can be so deep that they even leave scars. So what we do in most of our patients is that we don't really work only with the IPL, but that we combine it with the Frax 1550. I'm sorry. So the Frax 1550 is one of the handpieces that you can purchase with the Nordlys laser, and it's a non-ablative fractional diode laser which induces thermal-coagulated microscopic zones in the deep dermis. Yeah, so what we do is we achieve, with a really low downtime, a dermal remodeling of the skin. Because if you look at your patients with acne, they very often suffer from really flabby skin, so from the deep inflammations, the skin has lost the elasticity. It has created scars, deeper or less deep. Yeah, so this is something we talk about later. And the Frax 1550 really helps us to prevent acne scars and also to treat existing acne scars. This, of course, depends on how deep they are. So with the Frax 1550, you will not reach the really deep ice pick scars, that's for sure. But at least you can, by improving the whole texture of the skin, you dramatically improve the skin in general, and people really appreciate it. Yeah. So what our approach is, to combine the PR 530 and the Frax 1550, and we start doing this in really early stages of acne. So sometimes not in the first session, but always in the second session, that we achieve a great improvement of the inflammation. Yes, so we reduce the inflammatory component of the acne, and simultaneously we improve the skin texture. So treatment protocol with Frax 1550 is pretty easy as well. If you use the mode, you find acne scars, yeah, which guides you to between 40 and 50 millijoule. You can adjust that a little bit. We usually do 4 passes with a 10 millimeter diameter. On some deeper individual scars, we might work with the 4 millimeter and do then 2 passes. Yeah, we see our patients every 4 weeks for the combination of both treatments. And I'm going to show you here a very short video. So first we apply a local anesthesia. Yeah, this is a combination of lidocaine, prilocaine, and tetracaine. And then we start our treatment. So let me see. Oh, I'm sorry, it was too fast. Sorry, I have to go back. Sorry for that. So let's see. Now, this should be the video. No, unfortunately, it's not coming.
Yeah, no, I think we can see it.
You can see it? Ah, okay, I cannot. Okay, perfect. So, yeah, so first you see PR 530, yeah, and then the cooling device. This is very important, yeah, to cool the skin very well. And then immediately after, you use the 1550. And then after that, we usually use calming masks, you know, to calm down the skin and to reduce this slight discomfort. So I will show you one of our cases. This is a patient who had 4 sessions in total. We combined, in his case, because you can see it's quite a severe acne, with isotretinoin low dose. So this patient received 20 milligram a day for 4 months. And then I always try to reduce to really super low dose. We treated him in the first session with the PR 530 with the setting I've told you, because you can see it was already very inflamed. So we wanted to get him used to the treatment. And then from the second treatment on, we combined the PR with the Frax 1550. Yeah, so 3 more sessions. Now you can see we reached, after 4 months, a really, really nice improvement of the inflammation. Also, the texture of the skin has improved, and now he's still left with some of the deeper scars, which have to be then addressed with a deeper laser with a CO2. Here's another girl. She came with 20 milligram isotretinoin monotherapy. So I can only tell you, please do not be scared in using a laser. It can be combined with isotretinoin without a problem. Yeah, if it's a non-ablative laser or an IPL. So we do this all the time without ever have seen a problem. And you can see how you can really reduce in a very short time the deep inflammatory component of the acne, and how you can improve the texture of the skin. Yeah, this is only after 3 months. Yeah, this was a patient who was quite challenging, so the treatment took really long on him. If you look on the left picture, actually the acne didn't appear so severe, but the problem in him was that every new nodule was super deep, intradermal, and very sore, so you couldn't really touch him, and it was a process which went on over really many months. Yeah, so we combined the isotretinoin with PR 530. He wouldn't let us do the fracs for the first couple of months because it was just too sore to him. But after I think 3 months or 4 months, we started to use the Frax 1552. And I saw him recently, and he has a big smile on his face, and he's so happy with his skin, and the acne has totally stopped. And we are now working with the CO2 on some of the deeper scars, but you cannot imagine how happy he is. And of course, this is for us the nicest we can see in our patients. It's another patient who came to us with strong redness, rosacea on his face. He suffered from acne when he was a teenager. He's never been treated at that time because, he just didn't know where to go to. And we treated him with the combination of VL and PR and improved then the texture of his skin with the Pico Way. Yeah, so this I also find a very nice combination. First, reduce the redness and the capillaries with the VL and PR in combination, and then work with the Pico Way 1064 Resolve. And the deeper scars we are addressing with the CO2 resurfacing. I think Didac is going to talk about this more afterwards. So what is the big advantage? We achieve a really rapid reduction of inflammation due to the IPL. So we always recall our patients the next day after treatment, and they already experience that the papules are on the way to melt, to disappear. So we see a really fast effect. So this makes people come back, even teenagers. We've never had a problem with teenagers, even though this treatment is not the most comfortable one, but they know what they suffer for, and they really love the results. Yeah, so don't be afraid. You can really do this. We always do it in the summertime. Of course, they need to be protected with SPF 50. This is that's for sure. But it's something that we treat all year long. Yeah, and the Frax 1550 flattens the scars, it reduces the pores, it firms the inflammatory tissue, and to do this at the same time, first saves us a lot of time in the whole process of acne healing, and leaves us satisfied young patients with who love the results and who send all their friends to us. Yeah, so conclusion of this is, again, one thing is, I think that we really have to work on, we need to early detect the severe acne progression. Yeah, so this is something we really have to diagnose the type of acne well, and at an early stage, we have to timely initiate the therapy. This is really essential, and not try with too many things that never really work. The IPL is an integral part of the acne therapy, and the Frax 1550 in combination can treat and prevent scars.
Hello, everyone, and thank you to Candela for inviting me to this speech. We're going to talk about combining protocols on treating acne and surgical scars with the Nordlys and other tools that we're going to see. So what I'm going to say is based on some references and also in our experience, right? So first we're going to focus on acne scarring. And this should be a very specific algorithm for acne scarring. So as Cordula said, if we see recent acne with erythema and the initiating atrophy, we may use the PR with these settings, the ones that Cordula said, or if you want to be more aggressive, you can switch to 0.5 milliseconds and 6 joules. You can also use the V-beam with these settings in case you have this device. And we also combine it with the fracs, as Cordula said. So we do a session every 6-8 weeks, and it needs about 4 or 6 treatments or so. But on the other hand, if we see all cell atrophy scarring, we should divide these into mild or moderate or severe ones. If we are addressing mild and moderate scarring, we may use the core with deep settings as the ones you see here, and a combination on top with fracs 1550 in the same session. So we would zap the core where the worst scars are, and on top of it and around it, the fracs. If we're treating severe acne scarring, we should use a targeted resurfacing with the core. This is a technique that I'm going to speak about in a few slides. And let's talk about recent acne in dark skin individuals. So the first thing we have to take into account is that we should not worry too much about photosensitivity, right? Most of the devices that we use work over 500 nanometers, and all the drugs that we take for acne, for rosacea, or for whatever disease actually, they give photosensitivity to UVB radiation, which is below 400 nanometers. So it has no strict relationship between drug consumption and the use of energy-based devices, right? So you can proceed cautiously, but in a safe way. So the settings I would recommend to treat phototype 3 or below this phototype would be the ones showed in the screen. And if we treat phototype 4 or over this one, we may switch to the VL handpiece, which is deeper, so it's safer, and we're going to use lower energies than with the PR. It's very important to apply cold and to use a stencil, so to keep the epidermis melanin safe and not to shoot areas that we do not want to treat, right? So we must focus the beam through the stencil to the lesions that we want to treat. We don't have to be very aggressive, especially in dark skin individuals, and we don't have to search for the purpura when we zap the SWT or any other laser. We only have to look for blush or light purpling of the lesions. So if we use the fracs 1550 on top of the IPL, we can use the settings that you see here. We can actually increase these ones up to 50 joules if needed. And if you want to be even safer, you can apply a tranexamic acid solution immediately after the treatment. So you will have laser-assisted drug delivery. You know that the tranexamic acid lowers the risk of hyperpigmentation. So it gives us some help in this topic. We'll also use a bleaching formula at home. I have written here if desired, but my advice would be use it always, every night, if the patient is phototype 3 or over this. You can see here an example. These are the before pictures of a patient with PCOS, who was treated with metformin, prednisone, and isotretinoin. And 1 month after, we started with 2 treatments using the fracs and the PR. And this is the after. You see that not only the color has improved, but also the texture, right? So see that the patient is phototype 4, right? She was quite suntan here, not that in the second picture, right? But you see the results, and that you can use these devices safely if you follow the advices. So if we address all acne scarring in dark skin individuals, I would suggest to use the targeted resurfacing technique, which is the one that we're going to show here. So if we have severe ice pick and boxcar scarring, we first zap them with a classic resurfacing with the core using the settings. We then move onto more conservative settings, but also aggressive on top and around of it. And on the very periphery, we use the mid mode in even more light settings, right? So that would be the case if we're treating severe acne scarring, and if we're treating milder acne scarring, we can use the core in its classic resurfacing mode, and after this, on top and around the scars, we use the frax as the settings shown here, right? So this is what we call the targetoid technique, and it's quite safe and effective. So if we are treating patients with high phototypes, 1 month before and 1 month after the treatment with CO2 or with frax, I would recommend to use a bleaching formula. We tend to use the one shown here on the screen. It's in a Biller base, which is an oil in water emulsion, and it should be applied every night for a whole month. You may use, if the patient has high risk of hyperpigmentation, you may use tranexamic acid orally with, well, actually here in Spain we have 500 milligrams pills, so it's just 1 pill per day. I guess that in the United States you have 750 milligrams, if I'm not wrong. So when you're treating patients, dark-skinned patients, and they have phototype 4 and over this, you should expect PIH, hyperpigmentation. Although you're very careful, although you use not aggressive settings most of the times, in some areas you're going to have hyperpigmentation, right? So we have to inform the patient that it is quite common to have this. We have to inform the patient that we can deal with it using not only the bleaching cream and maybe the tranexamic acid orally, but we can also speed it up with the frax, right? And the tranexamic acid solution. So expect hyperpigmentation in very dark skin individuals. Do not fear this, right? And be tough with the treatment. If the patient, when we're informing him, is reluctant to PIH, we can dramatically reduce the risk of it if we lower the settings that we have said before. And we may not do the targeted resurfacing with a classic mode of the core, but we should use the deep mode and or the frax. We should lower the settings and then increase the number of treatment sessions if we want to reduce the risk of hyperpigmentation. So here is a fair-skinned individual which was treated with 3 sessions of this targeted resurfacing technique. We use the core in the very center of the lesions in its classic mode, and then we did the whole area with the frax at these settings. It was 3 treatments, and they were 3 months spared in between. Another case here, 4 treatments combining the classic CO2 and the frax. See that the box scar and ice pick scars have almost completely gone. Another case showing the result of the targeted resurfacing. We only use the core here because the patient was quite fair-skinned, and she allowed us to do an aggressive treatment. And this is the before and after 2 treatments using the settings that you see on the screen. Another patient, in this case, she's phototype 4 with severe box scar and ice pick scarring. So what we did here is a preparation with 1 month before the procedure, we used the bleaching cream, and 1 month after the procedure, we used the bleaching cream and also oral tranexamic acid. And this is the result after just 1 session. Sorry, it was after 2 treatments with the targeted resurfacing technique. Here's another phototype for patient, which was also treated combining the CO2 targeted resurfacing technique. So you see that with this technique and also using the Nordlys, it's quite safe. You see the sequence here of the scabbing caused by the settings that we have shown. The patient will have scabs for a whole week, and the redness may take about 2 or 3 months to completely go away. And now let's move forward to surgical scarring. And with scarring that is not atrophic, or that it is in another part of the body, except for the face, we should explore the scar and see the thickness, the stiffness, the erythema and tension and time of evolution that it has. And depending on the semiology, we should use the chromophores in our favor to take profit of the process of healing using energy-based devices, right? So if we are quite quick using vascular lasers or fractional devices, we can actually regulate the process of skin healing so to reduce the risk of hypertrophic scarring or keloids. So many years ago, most of the derms and plastic surgeons defended the surgical scar revision in 6-12 months after the trauma that caused the scar. But currently, we normally advocate for preventive treatment and to apply energy-based devices recently after the trauma, right? So the current evidence recommendations is start using the energy-based devices when the inflammation starts. So it's between the first 3 weeks after the trauma. You can use either vascular or either non-ablative fractional laser. All right, so this should be our protocol when we're dealing with a surgical or traumatic scar. At the stitches removal day, we start with vascular devices. Either it's an IPL or the V-beam. With these settings, we combine it with a frax, and after this, we apply a silicone gel. And we repeat this treatment every 4 to 6 weeks. So the rationale behind the vascular lasers is reducing the excess of permeability, their anti-inflammatory effect. The frax modulates the collagen production. And last but not least, the silicone gel or dressing helps with reducing the transepidermal water loss. So here is an example of a very recent scar. It's 6 weeks scar evolution. And this is the result after 3 treatments combining the Nordlys with a vascular part and the fractional CO2 on top of it. Here is another example of a dog bite reconstructed with a flap. And this is the result after 2 treatments combining the PR and the frax at the settings shown here. Now the case, recent scarring, 2 months evolution, combination of vascular and fractional, in this case, ablative laser. All right, so as a summary, when we are addressing surgical or traumatic scars, the idea would be, especially if they have hypertrophy or if they are keloids, we may use the vascular devices at the settings. We also should use contact cryotherapy. After this, intralesional drugs at the proportions that you see here, and on top of it, you can use either the core or the frax and topical medicines on top of it. So if you're addressing a keloid, that should be the algorithm that we use. We've talked about the efficiency of the laser and their mechanism, and the contact cryotherapy helps with collagen fibers breakdown, causing thrombosis and also direct cell damage to fibroblasts. And finally, intralesional drugs do apoptosis and anti-inflammatory effect. So we see an example here of a burning scar, severe burning scar, 5 months evolution, and here's the result after 6 sessions of PR contact cryotherapy, intralesional mixture of triamcinolone acetonide and 5-fluorouracil, and also the core anesthetics. We used all these tools all together in every treatment. So see that not only the redness, but also the thickness and the mobility or the stiffness of the joint improved with the treatment. This is the other side. And you will see here a video of this combinational treatment.
It's playing now. We can see it.
Oh, you can see it. Excellent. Perfect. So what we do first is pass the PR, and we then close the vessels that are visible. We do a second pass normally for the non-visible vessels with shorter pulse lengths. After this, we do the contact cryotherapy just for a few seconds. On top of it, we do the intralesional injection. Normally we use half and half triamcinolone acetonide and 5-FU. And finally, if we want to improve the final texture of the keloids or hypertrophic scarring, we use the Frax. Is the video done or is it still playing? Right, so let's move forward. Great. We see a result here after three treatments of vascular device with a PR, contact cryotherapy, a mixture of triamcinolone acetonide and 5-FU, and last but not least, the core. So see that if you combine different pathophysiological mechanisms, the result is much richer than if you only do a monotherapy. So some tips and tricks in surgical scars or keloids. We can use the PR. If you go at these settings or beyond in terms of jowls, you may obtain purpuric endpoint. That's good if we are searching for this. That's dangerous if we're not searching for this or if we're treating a high phototype. You may use VL555 and cold and the stencil if you're treating dark skin individuals, and we don't have to search for such an aggressive endpoint. So if we see some red scarring, we can use a vascular devices, but I would avoid the neodymium if you have subcutaneous stitches, because the neodymium beam goes very deep. It may hidden up the stitches and cause an ulcer. So here you see the example of a purpura caused by the PR handpiece at 2.5 milliseconds and 10 joules. This is a hypertrophic scarring treated with a PR. So it's tips and tricks about the Frax. The Frax is safe almost for any type of skin. And if you even want to reduce more the risk, you can apply the tranexamic acid solution after the treatment if you're worried about it. And the same applies to the core deep mode. It is safe because the density of this mode is very low, and especially if you go below 60 millijoules, it's normally very safe even in dark skin individuals. The key here is avoiding with fractional lasers, high fluence and high density when treating them.